Network, and it's a pleasure to be with you today. With that, let's kick it off. It's my pleasure to introduce you to one of our co-hosts, Grand Challenges Canada, of this webinar, Michelle Cruikshank, who is the Early Childhood and Education Lead at Grand Challenges Canada. So I'll hand it over to you, Michelle, to welcome everyone and share a little bit about the context of the webinar. Over to you, Michelle.
Great. Thank you so much, Akufe. Good morning, good afternoon, good evening, everyone, and thank you so much for joining us today. It's a privilege to welcome you to the launch of this important new scoping report. First, let me just extend a heartfelt thanks to the authors, Professor Mark Tomlinson and Dr. Rachael Glaser, for their vision and their rigor, and to our partners at the Early Childhood Development Action Network for working with us to bring this report to life and to today's global stage. And also to today's panel of global experts who bring additional insights and knowledge to this important conversation. This report began as an internal tool for our organizations. The purpose was to help guide our strategies and priorities. We knew the pandemic had profoundly disrupted children's lives, but we wanted one place to bring together the many reasons why and to ask, where can our resources have the greatest impact? That process convinced us that this report needed to be public for the benefit of the wider community, and what emerges is sobering. The line between humanitarian and development context is increasingly blurred. Crises now overlap, compound, and cascade, pushing over 100 million children into poverty and disrupting early education for more than 180 million children. At Grand Challenges Canada, we are already applying these insights to our Saving Brains and Play, Learn, Thrive strategies, supporting innovations and strengthening ecosystems so that nurturing care is embedded in public systems for lasting impact. But this work cannot be done alone, and this report is not just for us. It's a tool for all of you, funders, innovators, implementers, advocates, policymakers. It offers evidence and direction to guide your work and reminds us that collaboration is essential. So as we reflect on these realities, we must also hold on to the question at the heart of this report: where to from here? And this is the conversation that we invite you into today. So with that, it's my great pleasure to hand over to GCC's valued partner and close friend, ECDAN's Executive Director, Elizabeth Lulay.
You're on mute, Elizabeth.
Sorry about that. Thank you, Michelle, for your introduction and for the wonderful partnership that we have with Grand Challenges Canada. Good morning, good afternoon, good evening, everyone, and a warm welcome to our panelists and participants. Thank you for joining us today to launch this very important report that is sobering, and the important discussions on our collective action that we will have today. On behalf of ECDAN partners, a growing network of 373 partners working with young children and their caregivers, I would like to express our sincere gratitude to Grand Challenges Canada and their Savings Brain initiative for commissioning this paper, and their support and valued partnership with the ECD Action Network as we embarked on refreshing our strategy in 2023. This report underpins the priorities the network agreed on in the ECDAN strategy 2024 to 2028, and how we would all work together to address these challenges. I'd like to thank the authors, Mark Tomlinson and Rachael Glaser, for their rigorous research, analysis, and the consultations they conducted with key stakeholders. I would also like to thank ECDAN's Technical Advisory Group, chaired by Mark Tomlinson, for their inputs, and all the key stakeholders and experts and leaders who provided inputs to produce and launch this report. I encourage all of you to read the report. Special thanks to Sanjana and Shikufe for their contribution to the whole process of producing this report, our communication teams, and Leith Davis, who designed the report. Today's webinar is about understanding the challenges clearly, while also lifting up the strategies, innovations, and partnerships that give us hope. We will hear from the authors, our wonderful panelists of experts, practitioners, and advocates who are working on the ground and the system and at the systems level and doing research. And importantly, we will consider what all of us can do individually and collectively to ensure that young children and their caregivers not only endure this crisis, and reversals to hard-earned progress, but have the stability and support they need to survive and thrive. We're so glad you're with us for this important conversation. And over to you, moderator.
Thanks, Elizabeth. All right, with that, it's my pleasure to introduce you to the lead researcher for this work, Dr. Mark Tomlinson, who's the co-director of the Institute of Life Course Health Research at Stellenbosch University. He's also the chair of ECDAN's Governance Committee on the Technical Advisory Group. And Mark, I hand it over to you to give us a brief overview of the findings of the report.
Thanks so much, Shikufa, and thanks to everyone attending. Yeah, first up, just to say thank you to GCC, particularly Sanjana, for all the work that she did with us during this report, all the chasing that she did of me when I missed many deadlines. And thank you, Sanjana, your patience was epic. Thanks to Shikufa and Elizabeth at ECDAN for all their work, and particularly, I think, to the ECDAN tag, who really contributed enormously to this. I'd also like to thank Rachael Glaser, who was my co-author, who did many of the interviews and worked with me on the write-up. So I'm going to assume that all of you have or intend to read the report, or at the very least the executive summary. So I'm just going to touch very briefly on this, because I think I'd like everyone, we spend much more time listening to the panelists, who I'm not going to tell you which ones, but there's some of them were in fact also interviewed for the work that we did on this report. First up, the interviews were conducted in the second half of 2023, and when we were thinking about this launch and at the end of 2024, I was worried then about were they still relevant, the findings, given that it was a year later. And then, of course, we had the first 6 months of 2025. As we know, much has changed in the landscape in those 6 months. I remain convinced that many of the points raised do remain absolutely true. We know that young children following COVID around the world are in a perilous state, whether that's in Gaza, in South Sudan, Ukraine, or Yemen. But I think also increasingly, even in countries like the United Kingdom, the United States, increasing rates of child poverty and children in states in various states of peril. We know, again, I don't need to speak to an audience like this, we know many of the reasons for that. In the report, we focus quite a lot on climate breakdown, on migration and humanitarian contexts. We also try to focus on the area of children with disabilities. There has been, pushback at various times in the last number of years about various documents and approaches, I suppose, where children with disabilities, particularly in the early years, have been neglected. And I think there's and sort of also fragile state of child protection globally. In terms of the interviews that we conducted with the stakeholders, I just want to touch on some of the points that came out. And again, you can read them in the executive summary and in the report itself. But in my mind, we know that many funders have now withdrawn from the field of funding early child development. We know that many remain and have committed to stay, which is fantastic. We know that, and this is a particular interest of mine, and I worked with Linda on a document around this previously, around the framing of how we think about this issue. For many people around the world, and I was in a meeting last week where the word early child development is synonymous with a place, with a creche, rather than an outcome. And that has various sort of consequences in terms of both what you focus on in terms of very early development, but also in terms of the life course. We've also seen in the last decade enormous focus on scaling and integrating early child development services into primary care. And I think in important strides, and there have been important successes, but I think if we're honest with ourselves, I think that we are struggling with this. And in another life, I could share some of my thoughts on, I think, why we're struggling with that. But a number of the the interviewees that we spoke to touched on these issues. And one particular quote that I now use an enormous amount that says that there's this gap between what they spoke about as the sort of petri dish of some of where we get evidence from in these randomized controlled trials, and that actually in the translation to the real world there's this massive gap. And the quote that I really liked from somebody is that what we've done is we've taken this evidence from trials, and that's sort of the flour. And what we've done then, when we want to scale or we want to integrate, is we put that flour in an oven, we turn it on, and an hour and a half later we come back and we assume we have a cake, which of course without the eggs, the milk, the baking powder, we don't. And I think that's an important thing for us to ponder in the field. And what is evidence? How does change happen? How do we scale? Who should scale? And I think these are key things for the field to think about. A number of respondents also spoke around the issue of financing, and I know that ECDAN, Elizabeth and Shikufa and others are doing much work in that area, and I'm hoping, if I remember correctly, that Dominique will also touch on this really key issue of financing. And so I assuming, as I said, everyone has read the report or will read the report, so please do that. And the report was framed when we did it using this term that I had heard for the first time used by UNICEF in 2023, and that of the Polycrisis, where children in the world were facing these intersecting crises all at the same time, whether it was COVID, poverty, climate breakdown, wars, and there's this notion of polycrisis. And Rachael and I used that in the report, and I really liked the term. But in the last year and a half, I've also given a lot of thought, and one of them was I realized that in fact it's not a new term at all. That the exact word polycrisis was actually used in quite a well-known book written by a number of French authors, at least 10 years before that. And then in further investigation found that in fact there was this term that was coined in about 1969, 1970 called the problématique, which essentially is the same definition as polycrisis. And so we've known about these polycrises and where children find themselves for many decades now. And then in exploring further, I've come across a number of people who say they don't like the term. They don't like this term polycrisis, because what happens is if we're faced with all these massive issues from war to migration to climate breakdown, is that it's very easy, and the phrase used by one author was, it's easy for us to sort of get into what the author called a council of despair, because it's then so difficult to act, and then we need to guard against that. And so I'm going to end what I'm saying by saying that's exactly what we're trying to avoid here. We know about the perilous state, and that all the panelists are going to do their best to speak to that, but also be very much forward-looking, to say what should we be doing, where does the hope lie, and introducing that, I just want to read a quote from one of perhaps my favorite poet, which is the Irish poet Seamus Heaney, and the quote is as follows: "Hope is not optimism, which expects things to turn out well, but something rooted in the conviction that there is good worth working for." End of quote. And I think all of us know that children are worth working for. So on that note, thanks for the opportunity, and I'll hand back to Shikufe and the panelists. Thank you.
Thanks, Mark. That was great. With that, it's my pleasure now to introduce the panelists who we will engage in a future-looking dialogue on the state of the field and reflections on the report, and their visions or their ideas about where we need to be paying attention to moving forward. With that, it's my pleasure to introduce you to Dr. Linda Richter, who's a distinguished professor at the Center of Excellence in Human Development at the University of Witwatersrand in South Africa. Welcome, Linda. Ariel Fitzben, he's an economist focused on social policies. He was the chief economist for human development at the World Bank and the director of education programs in the Inter-American Dialogue, which was very important in setting up or engaging in many Latin American focused networks on early childhood development. Nirmala Rao, Dr. Nirmala Rao, she is Serena H.C. Young Professor in Early Childhood Development and Education and Chair Professor of Child Development and Education and the Director of the Consortium for Research in Early Childhood Development and Education at the University of Hong Kong. Welcome, Nirmala. Dr. Patricia Kitsao-Wekulo, she's a research scientist and the lead of the Early Childhood Development Unit within the Human Development Team at the Africa Population and Health Research Center. Welcome, Patricia. Apologies. And finally, Dr. Dominic Richardson, he's the Managing Director of the Learning for Wellbeing Foundation and Institute, focusing on policy for early childhood development and family well-being. He had previously spent nearly a decade leading two of UNICEF's global research teams on social policy and education. And so welcome to Dominique. So with that, I will hand over to you, Mark.
Thanks for that, Shikufe. And so what we've done is we're going to ask each of the panelists to speak for 5 minutes and do our best to hold to that, and then go back to each one of them in turn to then, respond to anything that anyone else has said or add to what they've said, that things that may have been, that may have been triggered for them when they were listening to the other speakers. So we have not, in mind, as I remember, decided on an order for that. So I'm going to start with the name that's first on my screen. So Ariel, I'm going to hand over to you, and if you can jump in and 5 minutes. Thanks, Ariel.
Terrific. Thank you, Mark, and congratulations to the team for the excellent report. I have picked one topic among the many covered in the report, and it's to say a few words, and it's the particular case of migrant children. And I think it's important to recognize the diversity of cases that we're talking about. We have clearly the most obvious situation of children that migrate internationally. This can be due to war, poverty, natural disasters, etc., violence. But there's also the case of internally displaced populations that it's also important to consider. Now, we know this is a group that is particularly vulnerable. And within the migrants, children and young children are particularly vulnerable. Typically, I think the most salient aspect that people recognize is linked to nutrition, but all the dimensions of child development, from the physical to the cognitive to the social-emotional, get very much affected in those cases. Important to recognize that migration is not a new phenomenon, and is not a transient phenomenon. It's been with us for many years and will remain. And I think because of that, it's incumbent for all of us to really approach it in a consistent way. I think it's important to look at both the case of the needs and how to approach needs of children while they're in the movement from one place to the other, as well as the destination countries or destination locations. And my main point is that they require probably different approaches and involve different challenges. So starting with destination countries or destination locations. Main point I think that I want to make is that here there shouldn't be a need for separate initiatives and programs. That in fact the challenge is one of integration, how to incorporate arriving groups in a new city, a new country, to existing public services for young children. And in fact, when you think about it, this is not too dissimilar to the efforts at including typically excluded population within the native excluded population. It's not automatic and it requires an effort on the part of government, but you don't want to set up separate parallel systems, but rather focus on the goal of integration. What is required? Number one is identification, being recognized, being part of a system, and this typically involves not only legal aspects but also operational aspects that are quite tricky. And then the challenge of incorporation is typically not only one of additional resources, which are very important, and I know some of my colleagues will be talking about that, but one of adaptation. Adaptation in the most basic way, it's maybe language and cultural traditions, but recognizing often the trauma that these children may have experienced in the process of migration that requires special attention. And the other aspect of this is dealing with possible resistance, and it's important to be clear and open about this on the part of both the native population or the earlier comers, as well as the providers, and this is often an issue. But in the end, the message here is that rather than trying to set up parallel programs, the effort ought to be one of integration. Now, the situation is different, and I think in terms of the challenges facing the groups that are actually in the process of migrating. These are often quite traumatic. I've worked on this in Latin America, and this has been quite often a process of months of moving through very different difficult terrains and situations. The reality is that the public services are often have had a very hard time addressing the needs of this group of children that are in one location for a limited period of time while they get ready for the next step in their travel. And here, it's been mostly NGOs and humanitarian organizations that have been the main providers of services and support to young children in this context. And in my view, that will probably remain the case, even though I don't want to minimize the importance of creating better coordination and links to the mainstream service providers. The key challenge, I think, is in this area is one of coordination. Coordination mostly among providers. And this happens both locally as well as across locations. Locally, typically these are the organizations that are providing services tend to be small, and because of that, they tend to specialize, whether it's on nutrition or health or providing some basic education, etc. But there is a challenge. Families and children are multidimensional, and so there is a need for cross referrals, if you want, and coordination across organizations in one location. But perhaps more challenging is the coordination across locations, across space. Just imagine, a family with young children leaving Venezuela and crossing the border into Colombia and staying for a couple of weeks in one location, and then after a couple of weeks moving to and trying to reach the border with Panama, and then having to cross the Darien, and continuing this movement. And they arrive into a new location and they start from scratch. And the organizations that are serving these groups in new locations don't know who will be arriving, when, with what needs, and they will not know what is it that they received or didn't receive in the previous location. Addressing these challenges, I think, very important, but very difficult. Even what we found working on these topics in Latin America, that even within the same organizations that have programs and initiatives in various places, there is a lack of information and coordination that allows them to be prepared when new groups arrive. Let alone thinking in terms of coordination across organizations. The key to addressing this is better information systems. When I was at the Inter-American Dialogue, we were working on something that initially we called a passport, but which was, and there are NGOs that continue working on this, which is trying to integrate their own databases so that the transition that these families and the children are going through is managed in a smoother way. I think I've run out of time, but I hope that this leave you with some food for thought in terms of what the direction for work in this area may be. Thank you.
Thanks so much. Thanks so much. Really painting an interesting, vivid picture of the state of things, but also, what can be done. I'm going to straight away hand over to Linda. You're on mute, I think, Linda.
Right. Yeah. Thanks, Mark. And thank you for inviting me to be on the panel for this important report. Now, when we think about how to make the world a better place for young children, let's not forget the very people who make early child development, both the survival and the development of children, possible. It was the British pediatrician, Donald Winnicott, who long ago in 1960 said there's no such thing as a baby. And by this he meant, of course, that when one finds an infant, one finds somebody who cares for the child. And he talked about maternal care. But in this context, maternal care is not restricted to a woman, to a mother, or even to one person. And I want to make this concept real by going through an example, taking that any woman's personal and family history, her health and well-being, the physical and social environment in which she lives, all determine a number of things. One, whether she conceives a baby with a caring partner if she chooses to. Her fetus develops normally without disruption from genetic distortion, deprivation, injury, toxins, or undue stress. Her baby begins to hear her mother's happy voice and feel her loving touch through the womb. The mother is healthy and happy, knowing her and her baby belong amongst people who love her and look forward to meeting their baby. The birth occurs close to term, uncomplicated, and with trained support for her baby's passage into a shared human world. Her and her baby survive the first hours and weeks after birth, remembering that about 2.3 million children died in their first month of life in 2024, and about 500,000 children died as a result of complications during pregnancy, childbirth, or the few weeks following the birth of the child. Most maternal and neonatal deaths and many childhood disabilities could be prevented by better health and home care and less stressful or deprived circumstances. Now, this mother also has a supportive family to help her at home, enable her to rest, breastfeed, and bond with her baby. Her partner and kin welcome the baby into the family, provide for their baby's nutrition and health, keep the baby safe and nestled in their arms, recognize her humanity, keep close watch on her, talk softly to her, and respond to her cries for help and attention. They identify facial and other features that are reminiscent of family members. They follow her awakening attention, comment on objects and events that draw her gaze, mimic her mouth and face movements, talk repetitively and liltingly to attract and hold her attention. They relish her smiles, her efforts to sit with help, attempts to wave bye-bye, her babbling. They have family wagers on whether she will first say the name of her father or mother. Now, these few examples show critical developments in brain and psychosocial development during the late stage of pregnancy and the first 2 years of life. These developments occur in the shelter and refuge of family and kin, and much of their importance is insufficiently acknowledged in our global concerns. But when we cite scientific findings to advocate for early child development, it is in this period of life where the evidence for rapid and foundational brain behavior and learning development is the strongest. The majority of the estimated 100 billion neurons in the human brain that we keep for life are generated during fetal development. Synapses, the connection between the nerve cells, form rapidly during the 3rd trimester of pregnancy, and they peak around 1 year of age, a period sometimes referred to as the Big Bang of brain development. So the human brain is being built very rapidly in these early stages, as are the foundations of communication and learning. Both of them, the brain and these functional abilities, are dependent on environmental conditions, including before birth. The fetal and infant brain are often likened to a jungle rather than a computer. It has to be organized, and the organization or the lack of organization occurs through experience with caregivers that induct the baby into broad human culture through nurturing care. Caregivers provide the scaffold for both the structure and functional development of the young child's brain and future potential. But the capacity of caregivers to provide this largely intuitive nurturing care is dependent on the safety, protection, and care that they in turn experience in the intersection between supportive policies, services, and community assistance. Under conditions described as the Polycrisis, maternal health and well-being, parental intuitive care, family integrity, and community cohesion are threatened, putting both the fetus, the infant, and the mother at risk for very long-term consequences. Now, pregnant women, new parents, and young infants, especially those living in precarious conditions of poverty, conflict, natural disasters, and migration, are the groups most vulnerable to the polycrisis. Pregnant women and young children are especially sensitive to the effects of climate change. Their physiology is particularly susceptible to extreme temperatures, shortage of food and water, and stress. They are unable to fend for themselves and are utterly dependent on the people and conditions around them. In my view, then, the actors in this field need to overcome what the Landscape Report calls very, very nicely a fragmented construction of human development, and incorporate parental, especially maternity care, seamlessly into our thinking about improving early childhood development. My plea is that policies, services, and programs to improve support to women and families, including male partners during pregnancy, birth, and the postnatal period, are urgently expanded as part of the early child development agenda. In my view, this would help to address children's development when it begins at conception. Thanks, Mark.
Thanks so much, Linda. That was lovely, and I love the idea of a jungle rather than a computer. Which I'm going to ask if you could please tell the large language model people who think they're going to create a human infant that they need a jungle model rather than a computer one. Thanks so much. Over to you, Dominique.
Thanks, Mark. Congrats on the report, and thanks. It's been very good to listen to Linda and Ariel. I want to start by making sort of 3 statements I think are important. First, that the polycrisis is not inevitable. This is a result of things that we've been doing, and we can certainly stop it. That I see ECD as being in crisis. If you want to talk about where the crisis really hits, it's in future generations. And I'm going to make other arguments. I think it's important for us all to be very clear to anyone who's involved that ECD is in crisis, and if it's treated like a crisis, we might get a suitable response. And the final thing I want to say is that inequality is at the heart of all of our problems, inequality within countries and inequality between countries. And we need better systems of welfare that start from the very beginning of life for all, meeting simple demands on coverage, whether it be migrant children or children born in country, and with adequacy, and responding to the real complexity of what it means to raise a child. And not just think, as Mark says, that flour in the pan will give you a cake. There's a lot more going on. We need a lot more ingredients. And right now, some of the pans across the world are actually empty. There's not even flour in them, certainly in the ECD space. And we really need to address that. ECD, at least if we think about mortality rates to start with, when I talk about ECD in crisis, every day, 13,000 under fives are dying from poverty-related causes, 13,000. And this is the lowest it's been for as long as records have gone. It's been achieved mostly through building infrastructure because most countries still don't have child or family-specific policy portfolios. So we could do a lot better. At the peak of COVID, 14,000 people died in one day. That's 14,000 people from the entire global population. I'm talking about 13,000 from the under 5 population. That means in terms of a health crisis, mortality of the under 5s is 10 times higher than the peak of COVID. So we talk about COVID as being part of the polycrisis, but we don't talk about under 5 mortality being part of the polycrisis. And we're not responding in a way that we should be responding in terms of building the systems that can protect children, more importantly, promote human and social development if it's done properly. I want to talk about social protection. I'll tell you where I think the money will come from in the end, but I want to talk particularly about social protection. If you're born in a low-income country, you can expect per capita to get around $2,500–3,000 US PPP across the life course. You get more if you attend school, but not everyone attends school. If you're born in a high-income country, you'll get 20 times that amount, and in some of the countries, at least 1/3 of that is given to the under 6s. With all of the 16 policies that could be put in place for the under 6s, whether it be a birth grant or family health services or home visiting services or the parenting interventions that Linda was talking about, maternity pay, all of those things are necessary, and a lot of them are in social protection. If you're born into a low-income country and you're under 6, you'll probably get about 7% of the total spending on children overall. So if there's $100 across the life course, 7 would be reserved for before you reached primary school. Now, this is entirely counterintuitive according to what we know, and Linda mentioned it, about child development. It's also contrary to what we know about family dependency, detachment from the labor market, maternal stresses, which can so easily be passed on to the children. We are critically underfunding the ECD period, and it's no big surprise, therefore, that we see some of these absolutely shameful statistics about mortality and nutrition and plus. We need to put in place at least, I would say, 16 separate policies in the under 6 period, because I think the cake we're trying to bake is particularly complex. I agree with Ariel that it needs to be complementary. I think it should be universal, and it should be progressively universal, not only because it means that every child gets a chance and the accident of birth doesn't affect what happens to them, but it also, there's diminishing marginal costs to going towards universality, which means we could include the new migrants, we could include the orphans and the displaced children without breaking the bank. In that sense, it's affordable. Right now, the most complex systems in the world spend about 2% of GDP on their under 6s. If you were to go, I'll just take Ghana, for example. I've been looking at this recently. The Ghanaian under 14 population is 35%. It's falling, but it's 35%. It's a pretty good example for Africa as a whole. About 1/3 of the population is kids. The Ministry of Gender, Children and Social Protection in Ghana last year, which covers all of the issues for social protection for children plus, spent 0.23% of GDP, 1/10 of the average OECD spending. And all that money went to the children whose families were eligible for the few social protection benefits that are available. So not every child gets it, and it's very low, and that's actually quite representative of most places. What countries need is about 2% or 3% of GDP to build the systems, the cakes, if you like, that will cover child development in the most meaningful way and help deal with this crisis that we're having, and hopefully help deal with the other things that we call crises, but they're not as serious a crisis for me as infant mortality. Going back to COVID, this is the last thing I'm going to say. Going back to COVID, the world saw this as a sufficiently large problem to put in a debt standstill initiative. The G20 said to low middle income countries who were paying back debt servicing charges, not the debt itself, not the principal, but the interest on that debt, like the interest on your credit card. They said, no, you don't have to pay it because too many people are dying and we need to do something about it. And that's worth about 3.2% of GDP per year. The one debt standstill initiative, based upon an ECD crisis, would begin funding serious ECD interventions for children across the globe in the poorest countries. And it's just a matter of us seeing a crisis where it is and asking for the requisite response. Thank you.
Thanks so much. Thanks so much, Dominique. And thank you for everything you said, but I did like, the idea that the polycrisis and where we are is not inevitable. I think we often look at our current state of the world and we think it's kind of the natural order of things, and it's not. And thank you for that. I'm going to hand over to Patricia.
Thank you, Mark, and congratulations on the report that has recently been launched. I'd like to move us to thinking about adolescent parenting and childcare, and some of the things that we need to think about when we look at this space, the intersecting crises that shape adolescent parenting. One of the most important that has been studied for a long time is or reported a long time in the literature is economic instability of the adolescent parents. And you find that this limits their access to childcare services, education and nutrition, which has a direct impact on their children's outcomes. And then it also increases pressure on them to enter informal labor markets so that they can cater for their children's needs and overall household needs. And then looking at generally the mental health epidemic, this one has been widely reported among women, pregnant and parenting women. But when you think about adolescent parents, it causes heightened caregiver stress because they're thinking about all these things that they need to put together, all these things that they need to have in place to take care of their young children. At the same time, they're thinking about their own situation and how to advance in their lives. And then this results in a situation where they tend to be disengaged because of the caregiver stress and the trauma that they're facing because of their situation of having young children. And when we think about adolescent parenting, we also must consider gender-based violence and the rigidity of gender norms. And because of this, we find that stigma against the adolescent parents is reinforced because of the norm rigidity, apart from the fact that they have given birth at a time which is not socially acceptable. They also have all these other issues of thinking about how to advance their own livelihoods. And this sort of creates a pressure ladder on the different intersections, the different groups intersecting with them, because you don't want to be in a situation where you're having to take care of the needs of an adolescent parent. We know that those needs will be very many, both for the parent and for the child. And in that way, then you find people keeping away from such parents because they don't want, first of all, to be associated with the stigma of adolescent parenting or adolescent pregnancy. And then secondly, they don't want to be held responsible for taking care of the adolescent parent and their young children. And then because of the norm rigidity, you find that adolescent parents have very limited agency their agency is somehow silenced because of the space that they find themselves in. And then this in turn, the norm rigidity in turn perpetuates unequal caregiving burdens. And you find in most cases, the fathers of these young children, of the adolescent parents, are usually unnamed or unknown because, first of all, of the stigma, and because maybe the relationship was not formalized and the adolescent parent is not comfortable with providing information on who the father of the young child is. One of the very disruptive crises for adolescent parenting is school dropout because of the pregnancy or the caregiving responsibilities. And we've seen a lot of studies looking at how childcare opportunity or childcare service provision can be embedded within a school system or an institution system where the adolescent parents are receiving some form of education. There have been studies testing if this model can work. Some of them have been shown to work to some extent. Others face different challenges in implementation, sustainability, and also scalability. So those are some of the things that adolescent parents continue to face. And then there's also another crisis when you think about the health system. There are weak referral pathways generally, but for adolescent parents, these have a negative impact because they are not able to get into the health system for any form of support, health support or psychosocial support for both their young parents and for both their young parents and their children. And this is related to my earlier point on stigma, where you find that even the healthcare facility workers, they tend to frown on adolescent parents when they go for clinic visits because it suggests that they are not really prepared to serve this population, and something needs to be done to change that so that adolescent parents feel supported in some way. Now, when we think about the Africa landscape, childcare and adolescent parenting, we see same issues coming up, and the points that I've raised are based on a study that we're carrying out among adolescent parents in one of the counties in Kenya. We're looking at gender transformative parenting, an intervention to enhance parenting skills for adolescent parents. When you think about the landscape across Africa, there remain, across the entire continent, there remain limited support systems because of the same issues that I mentioned. Adolescent mothers face stigma, their education is interrupted, and then they lack psychosocial support. And then the fragmentation in service delivery means it's very difficult for the different systems, health, education, social protections, it's very difficult for them to coordinate to meet the complex needs of young parents. And this in turn has an effect on the care that young children receive because the adolescent parents do not feel adequately supported by the systems, which affects the quality of caregiving that they provide for their young children. And then we keep seeing many studies over and over again, fathers, they're often excluded from caregiving roles. And this stems from sometimes the women themselves, the adolescent parents themselves. There's a female gatekeeping where adolescent parents or mothers or women in general tend to frown upon engagement of fathers in caregiving roles because they tend to feel that these roles are not really for men. And this reinforces the maternal burden and it limits the shared responsibility for caregiving. When I think about the project that we are carrying out, if we want to shift norms around caregiving, we need to think about continual sensitization. One-off sensitization is not enough. And if you want to see sustainable change, we need to have repeated facilitated conversations within trusted community spaces for the specific communities in which we're working in. And then we need to think about how to reframe fatherhood, not just to encourage it, because men often feel excluded and ill-equipped to parent, especially when they are not in a formal union with the adolescent parents. And And then we also need to think about how we can improve mental health for adolescent mothers. And this can be done through the FAST health system that the adolescent parents engage with, where mental health referrals can be embedded within the system so that these parents feel that they're receiving the required psychosocial support. And then when we think about multi-sectoral collaboration, this is a non-negotiable. We've seen it in different studies. When you're looking at provision of care, support for adolescent mothers, we need to make sure that all these different sectors are brought together, because childcare and parenting challenges, they intersect with education, health, legal, and economic systems. And we need to engage ministries or the departments, the different departments, when we are thinking about program design to support adolescent parenting, to ensure holistic support and sustainability. Thank you so much.
Thanks, Patricia. And yeah, as with everyone else, thanks for lots of really, important, interesting points. And thanks for touching on maternal education, which we know is one of the single most powerful interventions to improve child health. And now over to our last speaker, but definitely not fantastic new speaker as well. So over to you, to Namala.
Thank you so much, Mark. Congratulations on your report, and thank you for inviting me to be on this panel. The report makes a number of worthy recommendations and outlines other priorities, and I want to speak to two of these priorities. One you just mentioned, that relates to women's education. I want to talk a little bit about women caregivers who play a crucial role in providing nurturing care that enhances child development. And the second priority from your report that you mentioned in your report that I'd like to address is the importance of scaling up quality center-based childcare and early childhood education to promote early childhood development. So there's a wide body of research that tells us that women's education, girls' education benefits child development. This is like preaching to the choir. We all know this, that when women are better educated, they're more likely to look after themselves. When they're pregnant, they're more likely to have skilled attendance at birth. They're more likely to stimulate their children at home. And we also know that education is very empowering for women. And so we know all this, but what has come out recently, which makes our case even stronger, is very robust evidence and data that show gradient relationships between education and having a skilled attendant at birth. There was studies make use of the demographic health surveys, and there's one particular study done in based on data from Ethiopia that traces skilled attendance at birth from and looks at maternal education, whether they're primary, secondary, or no education. And clearly, the more education a mother has, the more likely she was to have a skilled attendant at birth. And through after 2000 to 2019, which was the last data point, there were many more births that had skilled attendants. As you know, South and West Asia, Sub-Saharan Africa, they have that has been a problem of having births without skilled attendants. That's increased. But what has been important, in addition to the demonstration of this gradient relationship, is what you've addressed in the report, and that is system transformation. So what they found is the index of inequality. They use concentration indices. The index of inequality in terms of skilled attendance at birth decreased in terms of maternal mortality. So if you're born in a rich country, whether you're educated or not educated, you have the safety network, right? You have the baby in the hospital. It doesn't make, there's not such a difference between no education and secondary education. So I think this is one of the things that I think is a important thing that the report raises as another priority. We really have to prioritize women's education. We also have lots of data from nationally represented surveys, such as the multiple indicators cluster survey from UNICEF, the DHS, the demographic and health surveys, and particularly in mixed, there's an under 5 questionnaire, and what happens is in many countries these surveys are done repeatedly, and one of the things that we looked at was the home learning environment. Home learning environment means what parents have at home in terms of books and toys, as well as the stimulation the parents give the children and the engagement. And again, you see this very clear gradient relationship. The more education a mother has, the more likely she's to provide a stimulating home learning environment. We looked at 28 different countries where they had more than one data point. Right. So from all over the world, or low and middle income countries, of course. So what we found was that, maternal education influence the home learning environment, but even more interesting, when we focus just on 3 to 4-year-olds, the more a mother was educated, we saw this gradient relationship again about her sending her child to childcare. And basically, childcare had the best outcome had the strongest relationship with child outcomes. The mix has an early childhood development index that asks about developmental skills. So basically, maternal education really matters to the home learning environment. It matters to children's outcomes, whether they participate in early childhood education and formal education. Um, the second point that I want to make is we talk about education, but how much education is necessary? Is it enough to go to primary school to see the maternal education have a difference on child outcomes? Do they have to go to university? What is the difference? So looking at actually data pooled from many, many countries, what we found was it's the completion of lower secondary education that seems to be where the threshold is. And that is what really makes a difference to under 5 mortality and childhood stunting. Okay, those two variables are the ones that we can measure very confidently across cultures. So what we find is the amount of maternal education that really makes the difference. The threshold is lower secondary education. However, when we've looked at the data across the years, today they need more education than they did before. So the threshold was lower before, and that's because we've moved to mass education, right? Before, maybe 20 years ago, fewer people went to school. So it was, but now, what happens is, with our education for all, sometimes we're not giving children the quality of education, the quality of school education they need. We know in some countries there's 70 children in standard 1. How much individual attention is a child going to get? So yes, we're talking about the lower secondary education is really important, but also we really need to prioritize the quality of education. Okay. So what we're interested in is the mechanisms. What is it that leads, why is it that causes girls' education to have such a positive impact on child outcomes? So basically, girls learn an academic advantage that is advantageous in oral communications with the health bureaucracy. They can understand radio messages and they can follow, use a mosquito net, do this, wash your hands. So they're able to understand messages, and educated girls also have greater economic independence. They have increased ability to negotiate and bargain in the home, community, and in economic life. So they also tend to participate more in public life, right? So, we know that girls' education is key. So what do we have to do? we don't only to improve early childhood, we have to improve girls' participation in education by addressing poverty, by having schools near homes, by providing toilets. We know that in low and middle income countries, when girls have their periods, they don't go to school because there's no toilet facilities, and of course having female teachers. So this is really important. I think I want to quote something from your report, okay? You say that addressing the issue of childcare is a synergistic satisfier, where satisfying one need, that is responsive caregiving for young children, contributes to the simultaneous satisfaction of another need, i.e. maternal employment and income generation, right? So we know in our field that researchers and policy makers, we tend to have one group of people interested in improving early child development, and you have another group tending to who are interested in women's economic empowerment. So we really need to marry these two, as you say. The income generation, women tend to use extra income to benefit their children, right? So I think we really need to think about childcare and women's education and women's empowerment and women's employment together. Childcare allows a woman to work, right? Allows them to generate income, improve the well-being of their child. And of course, that childcare has to be of a decent quality, right? We have to look at the counterfactual. So I think the report, in conclusion, right, addresses the needs of children against the backdrop of climate change. It focuses on children with disabilities, child protection, providing adequate funding for the life course, and building or transforming systems to be shock resilient. I think we should also keep girls in school and open pathways to skilled work, and expand affordable childcare to enable women's employment, reduce poverty, and mitigate the impact of the polycrisis. Thank you.
Thanks so much, Namala, for amazing, touching on key issues such as quality of childcare, on maternal education. Yeah, thank you. Thanks so much. I'm very aware that there are a number of questions and answers, that have been put up, and I'm also aware we've only got 25 minutes left, and it would be nice to engage with those questions. So what I'm going to, instead of going back to each panelist, I'm going to ask just to have an open question to the panelists, whether there's anything that's absolutely burning that you would like to touch on, any one thing in response to what has been said, or if I can then point you all to some of the questions that are in that question and answer, or in the question section, and perhaps touch on those. So first up, is there anything burning that you've heard that you would like to touch? Sorry,
Yes, Mark, we
Katie,
lost you.
my Zoom just crashes. I'm so sorry. It may happen again.
That's
So,
okay.
yeah, can I just quickly hand over? Any panelists have anything burning that they'd like to say before we go to the questions? Linda and then Dominique.
Yeah, I mean, I found it very interesting that a couple of people in the Q&A talked about, the resources, what already exists, because we keep talking about what needs to be done, needs to be added. I'm a huge proponent that parents and families are the greatest resources that any child has. It always stuns me. And when we talk about programs, we talk about minimal interventions in children's lives, seconds within the days that they are living. Everything else is happening in the company and in interaction with the usual people in their lives. And these are enormous resources. I just feel we don't recognize them enough. We don't celebrate them enough. We don't support them enough. What they need is more of a decent life to be able to care for their children. And that takes us big to the poverty and equality issues, the social protection issues that Dominique raised. We have to get on the same page together with a lot of other groups advocating for these world issues to be addressed, to make life more livable for the parents and families who, the numbers of children being born is declining everywhere. There's just been a big Nature article on this. Even in Africa, numbers of fertility is dropping radically. And one of the main reasons is just it's too hard to be a parent. It's just too expensive. It's too difficult. If we don't get behind parents, we're not getting behind the single most important resource that children need. So that's just the point I want to make.
Thanks so much, Linda. Yeah, very, very well taken. Yeah, it's not always an external intervention, or even, predominantly. Thank you so much, Dominique.
Yeah, much as it's useful, I wanted to second Linda's point. The family is the fundamental building block of society. And I get a little frustrated when we talk about crises as if they're somewhat exogenous to the family, when actually the crisis is experienced by the family. You might call it a climate crisis, but it's experienced by the family. You might call it an urbanization push or a population shift, or but the experience is embodied in the family, and within the family, those most sensitive to those crises are those that are going to be around the longest and with the highest dependence right now, and that's the youngest children. I want to just say something on evidence, because the call for an integrated approach means we need to be a lot smarter with how we evaluate and understand the effects of our policies and interventions. And we need to learn from all of the really good things that people are doing at localized levels or through NGOs and whatnot. There's all sorts of things going on. But like the report says, and we've been saying for a while, and we need to look towards evidence that not only shows effect, but shows it at a population level, and shows an ability to apply at scale, and understands that some things we think work now work in a pan with just flour. They don't have the strong health systems, they don't have the strong education systems, but the parenting approaches in some systems are working well despite the lack of a complementary model. And we really need to kind of pick that apart, be super smart with it as we build these comprehensive portfolios of policies. And for me, that throws out of the window a lot of the experimental evidence, unfortunately, because it black boxes the contextual covariates. We need to be looking at, natural policy experiments. We need to be, instead of just saying context matters, we need to be analyzing context and really understanding its role in the development and expansion of things. There's a lot we can do. There's a lot of promising practices. The universal child benefits, in a recent study we did for UNICEF, published at the UN General Assembly last year, I picked 5 promising policies, and immunization was one, but the evidence I've been building over the years show very, very clearly for population level effects, universal child benefits are exceptionally important to oil the wheels of the family process. They help people get into services. They help kids go to school without being hungry. They help people seek out child protection support. They help people get to the doctor. They're absolutely fundamental and necessary. Unfortunately, they're expanding across the developing world, whereas they're being targeted a bit more in the developed world, which is a very odd state of affairs, certainly from the countries that have had them for a long time. So that's one area I would start with. The foundational policy is the universal child benefit. It's a recognition of the children as being the future of the societies we live in, but it's also true to our obligations to them through the rights, UNCRC, the UN Convention of the Rights of the Child, which needs to be met also. I'll stop there, but I could keep going.
Fantastic. Thanks, Dominique. Any of the other panelists got anything burning? And I think as you're speaking, I think we are certainly answering some of the questions. Particularly, I think the questions, there is a thread on what are the resources available. And maybe just while people are pondering, I mean, I do think, and I completely take Linda's point and Dominique's point, and the bedrock is the family, and it's what are the obstacles to families being able to do what they can do best and will always be able to do best and better than any person coming from the outside. But just to note, there are important resources out there. A lot of them are on ECDAN website for people to, people have been asking about that. And I know that Shikufe can point people in the right direction, as are, resources like in the Saving Brains portfolio of Grand Challenges Canada. Many, amazing initiatives over the last 20 years in that regard. So yes, there are, and And certainly ECDAN and GCC can point you in that direction. Any other comments from Tusha, Ariel, Nimala? Anything you'd like to add?
If I may,
Yes, Ariel.
I get the sense that a lot of key organizations that have supported the ECD agenda globally are starting to lose patience. And I think that's a very dangerous outcome. 20 years ago, the ECD agenda was really a marginal one within the development field. It has, thanks to important not only investments, financial investments, but also excellent research and very strong advocacy. I think it gained gradually recognition and salience in policy debates. I've seen this very clearly. I've worked a lot in Latin America. As 20 years ago, you would meet with ministers and this would not appear on their list of topics. And that changed, which is the good news. But progress is slow. And human beings tend to be impatient. And a lot of key organizations shift their priorities when they cannot really demonstrate that they've achieved goals over whatever period of time they set up to doing this. So I think we're facing, this is a critical moment. And thinking about not only international organizations, but a lot of foundations that have been played a key role in sustaining the ECD agenda. I think it's critical that they move to new topics. I understand that the development agenda is broad and there is lots of issues and challenges. But I think it's critical, the message is that it's critical that we keep the eye on the ball and continue sustaining and being patient over time in order to achieve results. Anyway, that's the point I want to make.
Okay,
Thanks,
Mark, I could,
yes,
Mark, I could add just something that I think I should stress, and it's based on the point that Nimala raised on women's economic empowerment and childcare. When we're thinking about the quality of childcare service provision, we know that that will enhance, like she said, it will enhance women's economic empowerment. But when we look at it in light of adolescent mothers, what are some of the additional things that we need to do to ensure that their needs are catered for? Some of them are back in school or other institutions, learning institutions. Some of them are back to work. And when we think about childcare service provision, are we only thinking about childcare facilities within the community, or are we thinking about childcare facilities within the institutions in which these mothers are enrolled? And then we also need to think about, I hope you can hear me.
Yes, we can. Yes, I can. Thanks, Patricia.
Okay.
Keep going. Yeah.
And then we also need to think about what policies are in place that specifically address the needs of adolescent parents in relation to parenting. Because you find that, like in Kenya, if I can give the example of Kenya, we have childcare policies and childcare acts in different subnational levels. but then we don't really have clauses within those policies or acts that mention the special needs or the special situations that adolescent parents find themselves in. And I think these are some of the policy and implementation issues that we should think about so that we can enhance outcomes for adolescent parents and their young children. Thank you.
Thanks so much, Patricia. Again, I couldn't agree more. Can I ask the panel? I mean, one of the questions I think that's been asked has been about the workforce. When one of the question and answers, and whether the panel thinks that governments and funders are providing this layer with what it needs to avoid burnout and stay the course. Do you think the critical adults in the middle are being ignored at our peril? Anybody wants to potentially comment on that question from the panel?
I'm quite happy to talk about the workforce and the government's role. I mean, obviously, one of the best ways of improving the quality of education is to improve the quality of the workforce. And when you talk to governments, they're willing to spend on professional development of teachers, on initial training, but how much training, etc. So governments seem to be willing to invest in quality, or at least training, because it's cheap. It's easier to train the teacher, and you assume that it'll benefit generations of children. However, that's not really the case. There are lots of issues with the early childhood workforce. First of all, we have a lot of attrition. Secondly, we're not attracting the right people. They're not given the respect they deserve. There's we talk about attract the right people, retaining them, having a proper system for continuous professional development, providing them decent work, decent working conditions. So it's very tough if there's one caregiver handling 40 children, right? I mean, they need to be in a proper setting, a safe setting, it's so they can give attention to children. So we have to have the proper infrastructure. It can be community centers work really well, but we need certain, basic materials. We need basic supports. So yes, workforce is really, really important, but we also have to really improve the status. At least they should be on par with primary school teachers, the early years. In all countries, well, in many countries, childcare workers are thought of as glorified nannies and not as professionals, right? So this is an issue. So it's a whole system thing. Yeah. So I think workforce is super important.
Thanks so much, Namala. And the issue, I mean, one of the interesting questions that was in the panel was around issues, and I think Dominique might want to speak to this around gender. And an example from Madagascar where as soon as little girls can count, that's considered enough, just because they might otherwise become more skilled than men and then not want to care for children. So I think issues of we've been touching on many gender issues in this conversation, Patricia and Nimala and Linda and others. But Dominique, do you have any thoughts you'd like to speak to that quickly? We've got about 4 minutes left before I hand over to Michelle and to Elizabeth to close. Yeah.
I'll be super quick. Thanks, Mark. I used to coordinate the gender responsive age-sensitive social protection work that UNICEF was doing with an excellent colleague, Rami Subramanian. The thing that we notice almost everywhere in the world is that social protection policies and other policies are actually not doing the job of closing differences and inequalities, categorical or income, but are actually contributing to recreating those gender differences and those gender norms. The moment you treat a man and a woman differently in a social insurance policy or a social protection policy, you're creating an incentive for those on the outside to treat those people differently. So if I meet a man and a woman with equal skill sets and I'm an employer and I look at the two of them, in most countries, the woman has a higher cost to me for no other reason then some policymaker has decided that there should be a difference between her and him when it comes to raising children. And that's not okay. There is simply no justification for a public dollar to contribute to increased inequality, because that's not the job of the public dollar or the public system. And I think, and I want to just link this now very quickly to the workforce, and Linda's point in the comments really worth noting. We don't want to go down the failed route of compulsory school. We've been doing it for 70 years. Countries don't learn their way out of poverty. And we don't get equality by putting effort into building a strong workforce to a system that only attends to half of the children, because the system then creates inequality. And then we have to fix it. The answer isn't not to build the workforce, but is to do things in parallel. Going back to everybody's point, we have a lot of things to do. If we're going to pick one first, we have to be really smart about it. In the meantime, we do everything in the best interest of every child and build things in parallel. Thanks.
Thanks, Dominique. And if you noticed, there were lots of claps and hearts and emojis flying all over the screen as you were talking. I think what you were saying really resonated with everyone. And yes, and thanks for pointing out Linda's point about there's many workforces, not just one. I think a really important point. Any last thoughts from the panel before I hand back to Elizabeth and Michelle for their closing summary or closing thoughts?
Mark, I put a couple, I know there isn't time, but I felt like this last question was quite important that someone mentioned. And maybe you can take that. Maybe you can reflect on that.
Which one is this? How do we maintain the sustainable point of view? I mean, one of the things that I've been thinking a lot about is this idea of a polycrisis and how it does have the potential to paralyze us in some ways because there's so much. And I do think, as somebody pointed out, it's not just dark. There's so many good things in all countries that people are doing, and it's about doing those things. Keep doing those things, do them better if you're able. And I think, there've been so many, for me, good ideas in this panel around thinking about where to put our energies, what might be the big wins. And none of us can even do half of what or anything close to what needs to be done. But I think we're all contributing in our own way, and we just have to keep doing that. When Linda, myself, and others were working a long time back now on the nurturing care framework, one of the things we kept thinking about was like when you're trying to write something for a rich country, a middle-income country, and a very low-income poor country, how do you do that without making the rich countries feel there's nothing in it for them, or poor countries feeling there's too much to do? And we try to really have a focus on everybody's doing something. So firstly, acknowledge that. Secondly, how can you do what you're already doing better? And is there any way in which you can slowly, and as Ariel said, we have to be patient, but keep adding things to that, because that's how things are going to shift, slowly over time. So I just, before I hand back to Elizabeth and Michelle, I want to say thank you so much to all the panelists. I mean, it's been fascinating. I've thoroughly enjoyed it and learned a ton, and thank you for your time. And thank you, Shikufe, for moderating. And I'm going to hand back to Elizabeth and Michelle for your final closing words.
Thank you, Mark, and thank you to the panelists for joining us today, but also for this important and rich conversation on young children and the polycrisis. I think we've explored what it means for children to grow, learn, and thrive in a world facing multiple overlapping crises, from climate change, conflict, to economic and health shocks. And thank you, Ariel, for highlighting the case of migrant children, which is likely to keep becoming worse as the demographic shifts continue. What's clear is that while the challenges are real and complex, they are not insurmountable. Young children have an extraordinary capacity for resilience. but only if we collectively provide the environments, care, and systems that allow them to flourish. That responsibility belongs to all of us, policymakers, practitioners, researchers, families, and communities. And I think as we close, let's carry forward 3 key reflections that I took away from the panelists and also the questions that came up. The polycrisis isn't a distant threat. It shapes childhood right now and demands action today, and demonstrates the inequities we have in our societies, and how equity must be at the center of what we do to reach the most vulnerable of young children and their families, and the importance of social protection as well as child protection. The second one is leadership and partnership. Solutions start from conception, as we were reminded, and require collaboration across sectors and disciplines, breaking down the fragmented approaches we've had, transforming systems, especially the ECD workforce. And our work and solutions must be grounded in evidence and informed by families and community voices. Taking a life course approach and context matters because of social norms. But what I also heard from this discussion, that this can only happen through mutual accountability, as one of the comments indicated in the chat. The third one is hope and possibility. Investing in young children is not only a moral imperative, it's one of the smartest, most transformative responses to the crisis we face. And in the comments, we heard about searching for poly solutions, because not one solution will solve the polycrisis. So distinguished panelists and participants, where do we go from here? We go forward together with vision, with courage, and with a relentless and persistent focus on giving every child the chance not just to survive these turbulent times, but to thrive as well. The power to solve this problem and this polycrisis is through our collective action. So on behalf of the organizers, I want to sincerely thank our speakers for their insights, our participants for your engagement, and all of your commitments to this cause. This webinar may be ending, but the conversation and the work continues, building on the strong foundations that we've built in the past. Thank you, and we look forward to building the path ahead with all of you.
Thank you so much, Elizabeth. Michelle, do you want to say anything, or should we just do you?
I think Elizabeth said it so eloquently, and I don't want to be repetitive, but just a final thank you to everybody for being here and for being part of this conversation. And we look forward to working together. Thank you so much.
Thank you. And thanks everyone, and enjoy the rest of your day.
Thank you. Thank you, Mark.
Thank you.
Thank you, everyone.
Bye-bye.
Bye.
Bye.